Live from the Broadcast Center in Los Angeles, this is KCAL 9 News at 4.
And now to the latest on the pandemic. We've been hearing more and more about breakthrough cases, fully vaccinated people testing positive for COVID-19. Well, top government health leaders have just announced a major shift. All vaccinated Americans will soon be offered a booster shot.
Officials from the top agencies, including the CDC and FDA, released a joint statement. It says all Americans will be offered a booster starting the week of September 20th and starting 8 months after that person's second dose of either the Pfizer or Moderna vaccines.
Now, booster shots are anticipated for the Johnson & Johnson vaccine, but there's no date for that one just yet. Officials say all 3 vaccines are effective against the Delta variant, but protection does go down over time. Here now to help us learn more about booster shots is Dr. Victor Waters, Chief Medical Officer at Dignity Health San Bernardino Medical Center. Dr. Waters, thank you so much for being with us.
My pleasure.
Why do you believe, Doctor, the booster shot program isn't starting for another month? Isn't time of the essence? Why not now?
Well, we've started the immunization early, about 8 months ago, and it really has taken time to understand the data and understand the risk and benefits. Most of the breakthrough infections are people that don't require hospitalization or death. That's good news. But if we really want to control this epidemic, then we really need to do everything, all hands on deck. What does that mean? It means we need to give these boosters. The delay is not a big deal.
And on that topic, do you have any insight into how the logistics will work? For example, so many people got their initial shots at mass vaccination sites, and it's not likely those are going to be starting back up. So how do you think the distribution will work this time around?
It's going to be a little bit of deja vu. It's going to be based on risk. So immunocompromised population, those that have been on chemotherapy, cancer, and others, they need protection and the maximum protection. And then you have healthcare workers, physicians, nurses, those in the front line. With the waning immunity now confirmed by data, it's really important, as they are frontline workers and are exposed potentially to the COVID virus, to get immunized. And then, of course, those are older, 65, much in the same progression. And by September 20th, they want to open it up and make it available to everybody. But that should be the general line of strategy.
Well, Dr. Waters, as we've been reporting, newly released studies suggest the effectiveness of the Pfizer and Moderna vaccines drops over time, especially when it comes to the Delta variant. What do you think that means for the future? Will more boosters be needed after this one?
Don't know yet. As far as we know, we got to get through this crisis and got to get it under control. And then the more time we have to understand its benefits long term, because ultimately right now the good news is, though the waning of immunity does occur, it doesn't always necessarily result in hospitalization. We have very few patients in our hospital system that are admitted because of breakthrough infections, unless they have significant comorbidities, hypertension, diabetes, obesity, those kind of things. They may end up in the hospital. That's true.
And doctor, do you think this could be an annual thing? For example, we get the flu shot every year. Are we going to be getting a COVID booster through eternity?
It might. There is certainly advantages because the way COVID has acted and behaved, and certainly variants, we may be doing and treating this as the flu. So I anticipate, based on the data, that we may have to have this as an ongoing process to keep our community safe.
You definitely have a very positive outlook, Dr. Waters, so that's a good thing. And of course, very reassuring to our viewers that we inform every day on the pandemic. So thank you so much for joining us today.
Thank
My
you.
pleasure.